The upper quarter and lower quarter screens are best used for pathologies that you might think are actually coming from the nerve root, whether it be cervical, thoracic, lumbar, or sacral. So if we have any type of symptoms that are neurological or might be referred pain, we would want to use these screens, or basically anything that we're not quite sure what's going on. Right? So we're going to start with our observation and history, obviously. Both the upper and lower quarter screens follow similar structures. There's going to be some component that takes your patient's history, observation, followed by active range of motion with passive overpressure to clear the structural areas where these nerve roots are. Upper quarter screen, you're going to be looking at cervical and thoracic. Lower quarter, we're going to be looking at lumbar. In your observation, you may be doing standing, you may be doing gait. You want to look at posterior, lateral, and anterior view. You don't really need a posterior view. Light touch on certain areas where these nerve roots follow, going from C4 to, what is that, T2, and on the upper quarter, and L1 to S4 on the lower quarter. So wherever they feel that light sensation, that is going to correspond to a certain nerve root. We're then going to test motor function with our myotomes. We're going to take some special tests for neural tensioning, where we're going to be actually mobilizing these joints and seeing if there's any type of nerve symptoms that are aggravated by the positioning. And we're going to do some deep tendon reflex to help us rule in and rule out damage to these bad boys.
All right, so first we'll start with active range of motion. Patient, if you want to stand up and face the wall. So go ahead and bend over and touch your toes. If no pain is elicited, we'll do some overpressure. Okay, good. And now we'll do extension. So go ahead and extend. Again, we'll apply overpressure. No pain is felt. Now we'll do some side flexion. So if you want to put your hands on your sides, that's good. Again, overpressure. There's no pain. Go ahead and do on the other side. Overpressure, no pain is present. All right, now we'll have the patient sitting down and we'll test for rotational. Go ahead and put your hands here. Go ahead, rotate to your left. And we'll apply overpressure. After the other side. We'll do overpressure if no pain is elicited. All right, go ahead and stand one more time. Go ahead and do a deep squat. Go ahead and face up. Go ahead and do a deep squat, and this is just testing the muscular strength and active range of motion. All right, so now we're going to go over some of the myotomal testing. So first we'll have the patient go ahead and do some single leg balance, and of course you'll do it bilaterally. So this is testing for L4 and L5. Okay, good. Now we'll have the patient do some heel walks. He'll be walking on his heels. This will be testing for L4 and L5 as well. Good. Now if you want to do some toe walks, so on your toes, this would be testing for S1. Good. All right, now have you sit down. We'll do the hip flexion. So you want to watch out for tripod sign, make this patient not leaning his arms on the table. So go ahead. Good, and this is testing for L1 and L2. Next we'll do knee extension. And patient here, extending, good. This would be testing the L3 and L4. Now we'll do great toe extension. So making sure he's resisting. Good. This would be for testing for L5. Got L1 here, L2 here, L3 here, L4 here, L5 here, S1 here, L1, L2, L3, L4, L5, S1, and S2.
Upper quarter screen we could use when we're suspecting pathology of the cervical spine, shoulder, upper extremity, like we said with the lower quarter, any type of neuropathic pain, so anything that's radiating, tingling, burning, anything that might have a radiculopathic origin, and that's where we use our myotome testing. We'll be looking for non-fatigable weakness and differences between sides. So myotomes, we're looking at groups of muscles innervated by either 1, 2, or sometimes 3 nerve roots. So talking C1, C2, we're looking at cervical flexion, cervical extension, and anti-rotation. C3, we're talking cervical lateral flexion and, well, C2, C3, C4 together give us that shoulder elevation. And we'll be doing these as manual muscle tests for each nerve root down to T1. As well as the myotomes, we're going to be doing dermatomes, which is the area of skin where sensory information is applied to the efferent pathway of the other nerve root. The other motor neuron reflexes are going to also address C5 and C6 and C7. C5 and C6 are going to be brachialis and biceps. C7 is going to be triceps. So other than the reflex testing and the myotome testing, all our neurological screens are going to include dermatome testing and neural tensioning. So going into the dermatomes from the nerve root level, C1 provides afferent information about your spinal meninges, so you're not really going to feel anything unless we poke something in your brain. C2 is your occiput, so the back of the head. C3 is going to be your posterior spinal column. C4 is going to be supraclavicular. C5 is anterolateral arm. So C6, we're getting that lateral radial forearm to the thumb. C7, we're getting the middle finger. C8, we're getting ulnar, just the ulnar side of the hand right there. T1, I do believe, is medial forearm. T2 is the apex of the axis. But we'll show you all of these in detail once we get our patient in here and up on this table. We can see our patient walking from across the room. We want to be able to pay attention to that forward head posturing. If there's any type of malalignment, could you stand straight for me, please? So we could use a plumb line, any type of geometric line, to see if they have any type of shifting. Could you actually have a seat for me now? So we got to clear the spine. We got to clear the T-spine, the shoulder. We got to clear everything in the spine. How are we going to do that? We're going to use active range of motion and see if that brings back symptoms. If not, we're going to apply passive overpressure. We're going to start off with cervical flexion. Please look down, chin towards your chest for me. Any symptoms there? Nope. So we're going to apply overpressure. Anything there? Good. All right. We're going to go to lateral flexion now. So bring one ear to your shoulder. Anything there? Nope. Okay. I'm going to apply some passive overpressure. This maneuver is also a Sperling's test. Other side, which is going to have low sensitivity, high specificity for finding cervical radiculopathy. Now we're going to do extension. So look on back and up. Any pain? No. So now while we have our client seated, our patient seated, we can continue checking out some of the dermatomes. Since we're right here, we have our hands on them. We can go occiput, C2, feel that? Yep. All right, C3, posterior cervical spine, feel that? Yep. C4, feel that? C5? Yep. C6.
Yep.
C7.
Yep.
C8.
Yep.
T1.
Good.
So I started doing some of the dermatomes, but there's still some other clearing exercises, active range of motion clearing exercises that we could do depending on what findings you're having during the screen. So we are also going to have cervical distraction and compression, but we are not going to apply any overpressure if they're, well, we're just not even going to try that. Usually when we're treating for distraction, we would want our patient laying. But for clearing, you can stabilize by placing your arms back on. We want hands behind the occiput, and you could get your L angle here underneath that ridge and lift. How does it feel? Let's also do some shoulder clearing. So you can have your patient seated. Let's do full shoulder abduction. So you're going to come out to the side like that. Beautiful. We could also go external rotation. So let's place both hands behind your back like you're relaxing. And here, how's that? Good. We can apply overpressure. Good. So now fold those elbows in. And we're going to test that C5, C6 by extending elbows and wrists at the same time. Beautiful, how's that there? So you guys see a lot of these tests are actually like nerve flosses. You can see many of them are crossing multiple joints. We're really just trying to stretch that whole sheath out. So let's go into shoulder abduction, manual muscle strength, and myotone test. So yeah, coming out here, resist me. Beautiful, that's C5. So we're gonna do shoulder shrug, so shrug these for me. Resist, that's C2, C3, C4. Beautiful. Leave your arms out for me. And flex. And don't let me break. C5, C6. So you're gonna have your arm out for me, and you're gonna keep your wrist bent. This is C7. Do not let me pull your arm straight. Come on, man, stronger than that. Be stronger than that. Other way, other way. So you don't want to let me pull you that way. Yeah. There we go. C8. Now extend. Good. And I believe, did we miss any myotomes?
Those are all of them.
All right, so we've done a lot of videos. We've done it a couple different ways. We're going to hit the deep tendon reflexes, and we're also going to hit some of the neural tensioning tests, just get them out of the way for you. So we're actually going to start off with our C5 and C6 deep tendon reflex tests. We don't have a reflex hammer, but we do have a basin wrench, or a faucet wrench, if you want to call it that. And we're going to try and get a good reading here on these. So actually, you know what? Why don't you try and hold that out so you can see my hand positioning while we're getting you on the bicep here. So you want them completely relaxed, super loose. Completely relaxed for me. Relax. I know you got to hold the camera at the same time. This can do a lot. So supinate for me. I want you to pull up into my hand here. Okay, cool, relax. So that was just to help me find his bicep tendon. Get yourself a little bit nice. So feel that bad boy right here. I still feel tension in it, so I know he's not relaxed. I'm gonna use my knee to help him out a little bit. Relax, 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 relax. So for the brachios, you're gonna have them in a neutral grip position. So we're gonna have you do a hammer curl. So pull up into my, good, good, good. And you're gonna go more for the muscle belly here. Good, relax, 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 relax. Relax. Okay. So let's see if we can get the tricep. So we're supporting it. So he's relaxed, shaky, loose. Olecranon process. You can feel that bad boy. Let's see if we can get a good one here. Use that dummy thumb. Now, might not be at a great angle because he's not really relaxed because he's at this internally rotated position. We're trying to get a good angle for the camera. So, relax completely. Flip up angle here. Relax, relax, relax. I want to feel your whole arm like in my hand. There we go. Sorry, you guys aren't going to be able to see this. I got to use my hands this way. There it is. Oh yeah, they can't see it. Well, I tried to show you guys, but okay. So really quick, we're gonna have our patient lay down on the table for us, and we're gonna go through our neural tensioning tests. So you're gonna have them so they have their shoulder a little bit off the table. So right now we're gonna check out the median nerve, the accessory nerve as well. What was that? The accessory interosseous nerve. So these are the main nerves that supply the muscles of the forearm. So anybody who's a laborer, so anybody who's going to PT school who works with anybody who has a lot of gripping, this is going to be a good one to do. So you're going to want to keep. Yeah. So we're going to keep shoulder depressed, abduct to 90 degrees or 110 degrees, flex the elbow to 90 degrees. All right. We're going to externally rotate the shoulder. Now here you want to be able to have a good position. In fact, I'll grab his hand here. Because as you externally rotate, you're then going to extend hand and wrist as you floss all three tissues. So you want to try and pull that nerve through all three joints. So to make sure that your symptoms are correct, if we have those symptoms provocated, have your patient laterally flex. Beautiful. After you take off some tension to test. So the second one, we're testing the median axillary nerve. Let's go. Musculocutaneous nerve, basically stuff that innervates the pec minor. So things where we're getting a lot of internal rotation, throwers, pitchers, stingers, thinking football. We're going to depress that shoulder with the hip. Now we're only abducting to about 10 degrees. We're supporting this elbow so it's nice and loose. We're going to flex that elbow. We're going to supinate, I do believe. Yeah. Like that. And then as we extend, we're trying to push all three joints. So we're kind of slightly pushing that elbow up against the force of our downward motion. And again, we could use that lateral cervical flexion to confirm our findings. So we just finished up with ULTT3. We just finished up with the tension test 3. We're going to go to tension test 4. So it's going to be very similar. We're going to depress with the hip, keep everything supported. From here, now we're going to pronate the wrist. We're going to flex the fingers and wrists as we extend. All right. So now, last guy. We're going to depress with the hand. Shoulder is abducted to about 90, 100. We are going to pronate the forearm. This one looks super fruity, but I love it. Get that good hand position. And then as we externally rotate, we're going to extend the wrist and the hand and laterally flex. So it's 3 motions here, 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 bringing it towards the head. I think I just, did we do them all? I did 4.